Now we continue with the gathering points. Gallbladder 39, the Great Shuttle. Bladder 39 is located 3 proximal to the highest prominence of the lateral malleolus on the anterior border of the fibula. How to find from the highest prominence on the lateral malleolus, measure 3 tune, 1 hand breadth in the proximal direction and locate GB39 in a depression on the anterior border of the fibula. According to some authors, it is located between posterior border of the fibula and the tendon of the peroneus longus and brevis muscles. When in doubt, choose the more pressure-sensitive point. Located on the same level, but 3 tune proximal is the bladder 60. Depression between the malleolus and the Achilles tendon is the bladder 59. In a comparable position but on medial aspect of the leg is the spleen 6. 3 tune proximal to the highest prominence of the medial malleolus, meeting point of the 3 legging channels. Needling vertically 1 to 1.5 tune. For the action, gallbladder 39 opens the channel, benefits the tendon and bones, benefits the marrows, clear wind dampness, clear heat from the gallbladder. Special features: meeting point of the marrow, important distal point for disorders of the cervical spine. The most important function of GB39 is that of nourishing the marrow. However, judging by the indication of this point, it seems to affect the bone marrow more than the marrow and the brain. It is indicated in chronic bone painful obstruction syndrome, or the B syndrome, which is characterized by a deficiency of the liver and kidney and of the sinews and bones. This point nourishes the bones by nourishing the bone marrow. The regular use of this point in old people is said to help to prevent wind stroke. Apart from this, it is an important point to remove obstruction from the lesser young channel from the lateral side of the neck, especially when the neck is very stiff and the person cannot turn the neck from side to side. In such cases, the needle is reduced quite vigorously while the patient is asked to gently turn the head from side to side. The GB39 in its capacity of gathering point of the marrow. To treat the neck, prefer an extra point that is near GB39 on the gallbladder channel. This point is called U2, which means disappearing bone. It is called thus because the point is located by palpating the fibula starting from below the GB39. The point Ugu is situated at the hollow where the fibula is not felt any longer as it disappears below the overlying muscles. The point is usually higher than the GB39. For the summary function, GB39 subdues liver young, those with headache, dizziness, stiff neck. It also expels wind, stiff and painful neck, inability to turn head, painful obstruction syndrome, the B syndrome of the neck. It also nourishes marrow and bone marrow. GB39 is the meeting point of the marrow, which is the source of both the sea of marrow, the brain, and the bone marrow. There's little evidence in the classical text of the ability of the GB39 to nourish the sea of marrow, in other words, to treat diseases of the head and brain, and even headache and dizziness are modern rather than traditional indications. GB39, however, has a strong action on benefiting the bone marrow, sinews, and bones, and is indicated for a wide range of disorders characterized by weakness, laxity, contraction, and pain of the limbs. This latter action is comprehended by its ability to dispel wind damp. According to the essential questions, in bone painful obstruction, the pathogenic factor reaches the kidneys. In sinus painful obstruction, it reaches the liver. In chronic painful obstruction, therefore, prolonged retention of wind damp which injures the sinews and bones will eventually deplete the liver and kidneys and hence the marrow. Prolonged deficiency of the liver and kidneys and insufficiency of essence resulting in malnourishment of the sinews may also give rise to atrophy disorder. By its action of nourishing the marrow and benefiting the sinews and bones, GB39 is therefore indicated for both chronic painful obstruction and atrophy disorder, hence the reference to the use of GB39 in wind taxation with heaviness of the body. Injury by cold pathogen leading to taxation and deficiency taxation. The term taxation here denotes the extreme deficiency that arises due to chronic retention of pathogenic factors. According to the Ode to Elucidate Mysteries, the great Han Dynasty physician who thought needled GB39 and GB30 for lameness of the legs, and immediately the patient was able to walk. The gallbladder primary and sinuous channel pass through different portions of the neck by virtue of its action benefiting the sinews and bones and activating the channel and alleviating pain. GB39 is the main distal point of the gallbladder channel for disorder of the neck, both acute and chronic. GB39 has a further action of promoting the smooth flow of liver and gallbladder qi and clearing gallbladder fire primarily arising from the transformation of stagnant qi. It is indicated for distension of the chest, anxiety, indignation, anger, and mania. Gallbladder fire may easily transmit to the stomach, resulting in stomach heat or obstruct the stomach descending function, leading to lack of appetite. The gallbladder sinew channel binds at the side of the nose, and the primary channel connects with the governing vessel at the Do1 by clearing gallbladder fire. GB39 is also indicated for dryness of the nose, nosebleed, and hemorrhoids. Thank you for your attention.